Today we are going to discuss about the structure of clavicle bone, the anatomy, general anatomy. So this is the clavicle, left clavicle, right clavicle, which attached to the sternum at the point, in the upper side. So this is the mandibular of the sternum, and attached there, and below it the first rib, and on the laterally it is attached to the acromion process of the scapula. This is what the acromion process of the scapula. So let's have a look of the clavicle bone. So the point which is forming attachment to the mandibular is covered by a fibrocartilage, and it forms a fibrous joint. So it is a joint of fibrous type which has limited movement and attached to the mandibular. So this joint is called a sternal facet, and the point medially is near to the sternum. So this end is called as sternal end. And if you look like this, so we can see a smooth surface going to the lateral side, and on the laterally it has a flat area, and this flat area is called as acromion end, because this area is near to the acromion process of the scapula, and it also forms a joint type of joint with that of the acromion process of scapula. So this is called as the facet of acromion facet. This is the acromial facet because it's forming a joint with that of the acromion, and this is not a fibrocartilage joint, fibrous joint. It is a synovial joint. It has a synovial fluid inside. So if you look on the inferior surface, the inferior surface is not smooth as the other surface. It is a rough surface having groove and tubercle. So toward the sternal end we have a tuberosity that is called as the costal tuberosity. So come like this, we can see a groove, and this groove is called a subclavian groove, and the subclavian groove is for the attachment of subclavius muscle. So the subclavius muscle is attached to that of the groove on the inferior surface of the clavicle bone. If we come on the lateral surface, we have another tuberosity or tubercle here, and this tubercle is called as conoid tubercle, and the conoid tubercle is for the attachment of conoid ligament. And on the lateral side, on the flat side, inferior surface of this flat area, we have a line that is called as trapezoid line. So this trapezoid line is for the attachment of the trapezoid ligament. So this is for the conoid ligament attachment, and this is for the trapezoid ligament attachment. So the name is according to that. So some few additional point about the surfaces is that on the lateral surface, as I said, that toward the laterally the clavicle bone is flat, and toward the superior surface that is the smooth, anteriorly also smooth, inferiorly rough, and posteriorly it is again smooth. This is about the smooth and rough surfaces. So what about the view? If we see like from the upper side, we can see that it is a curved structure, it is not a straight bone. So toward the point formation bone with that of mandibular, this is a convex surface or the convex area. We can see like that it is convex like this. This is the convex. Interiorly we look that it is a convex area. If we see like to that of the acromion end, we can see it's a deep impression here. So it is not convex, it is like concave structure, we can see. So it is medially convex and laterally concave. And what about the shaft? in the midpoint, or we can say that 1/3 or 2/3 of the shaft medially it is cylindrical, and 1/3 laterally it is flat. So this is all about the clavicular bone.